Good afternoon, it's Mark Larson, it's Monday, and we still do not have an answer back yet in regards to our application for phase three. We are waiting. We are still meeting criteria for phase three, so I would expect that we will be hearing from them at some time soon. And let's go to questions.
We've been told on a couple of occasions by the person answering the KVH COVID-19 clinic phone number that if a person does not have insurance, a COVID test will cost $260. Then we were told by the EOC that there should be no charge. Which one is correct? Thank you.
Yeah, so there is a requirement to have insurance to be paid for COVID-19 testing. There is charity care that's available through the hospital if you ended up having a bill and you would have to talk to the hospital about charity care. There's also an ability to work with Navigation Finder at the health department to get health insurance, and we're happy if you call here to the health department to help you get signed up for health insurance.
You've said that Kittitas County can be more strict than the guidelines issued by Inslee. Do you foresee that happening, and what type or types of scenarios do you think that would apply to?
Well, that statement was we can be more strict with almost any type of health issue than the state. We cannot be less strict than the state. So, for example, our issues with water availability in Kittitas County, we are stricter than the state in regards to water availability for building. But in regards to COVID-19, we already have made a situation where we are stricter than the state in regards to not allowing the students from Central Washington University to come back after spring break. So that was a issue that we decided was important to us to make a decision. We also, in our initial health order, were more restrictive in regards to rental properties. We did not allow rental properties in Upper County, well, in the county at all, where the governor kind of glossed over that issue. So those are the kind of issues that can come up. So we can always make a decision to be more strict. We cannot be less strict than the state. And it's not just the governor, it's the State Department of Health, actually.
What is the holdup on our answer for phase three? It seems as if King County knew very quickly about moving to the next phase, but we are chugging along, almost done with week 4 of phase 2.
Yeah, it kind of depends on what's happening on Secretary Weisman's plate. So my guess would be that because Yakima is exploding with cases of COVID-19 and the state is busy trying to figure out how to control that, how to not have people die in Yakima of COVID-19, how to control their hospital situation down there. They currently are not meeting any metrics. I take that back. One metric that they're meeting is the less than 80% hospitalization. I think they're 79% or 78%, but otherwise they're not reaching any metrics. We are concerned about folks in Yakima who live in Yakima working here, and people that work here or live here that work in Yakima. So my guess is the reason that hasn't come to the top of Secretary Weisman's plate is that he's busy trying to make decisions to save people's lives in Yakima. I would expect us to get our movement into phase 3, but it is not a get out of jail free card. It does allow groups of less than 50 to get together, so it allows some youth sports to happen. It allows a little bit of a expansion of restaurant things. But what we've been seeing, and we've had a few cases that were positive over the last couple of days. These are all people that are out and about. They're people that are going to restaurants and getting sick there. There are people that are having get-togethers at their houses with other people and are getting sick there. So my ask to all of you, even though we're going to go into phase 3, is wear a mask, maintain social distancing, go to as few large events as you can, because anytime we're around more people, that we have more chance of getting disease. And the more we stay at home, the more we wear a mask, the more we socially distance from others, the quicker we're going to move through the phases. Now, The next question people always ask is, what about phase 4? There are no metrics for phase 4. People say, well, we can go into phase 4 in 3 weeks. That is not true. The only metric we have is it needs to be at least 3 weeks, and then all the rest of the requirements aren't there yet. So be kind to your neighbors, especially the neighbors to the south and to the east. They are having a lot of COVID-19 currently, and be kind to your neighbors on the west because they've got their own issues they're dealing with. So including increase of COVID-19. So we'll talk to you tomorrow. Thanks.